My name is Leslie Horton. I'm the director of Yavapai County Community Health Services. And I'm joined here today by Sally Slater, and she is our nurse immunization supervisor and coordinating a lot of our vaccine efforts for Yavapai County. I'm also joined by Josh Goldman. He is our community public health emergency preparedness coordinator. And he's also worked with many of you on PPE distributions and other things. And so hopefully between the three of us, we can provide our expertise and knowledge at this point on vaccines and what we know of what's coming our way. And if you have questions, we'll try to answer them here. If we can't answer them here, we will take them back and then try to answer them later. But this presentation will be will be posted to our website as well as probably our Facebook page after the fact. It might take a little while, but if you have people who wanted to watch and didn't get a chance to, they're more than welcome to catch them later. They just can't ask questions at the time, and we wanted to give you that opportunity to ask and get answers as we are here today. So thank you everybody for joining us. And David, could you go ahead and put the PowerPoint presentation up for me? All right, and as David mentioned, you are all muted so that we don't have any background noise, but please use that chat as you would like to, and hopefully we'll answer much of what your questions might be in the presentation. If we don't, we'll work on getting those answered at the end. So first slide. So our vaccine is supposed to be arriving next week. As of today, Moderna, which is the second vaccine to seek emergency use authorization, is going before the FDA, and they're supposed to and slated to be approved for emergency use authorization by the end of the week. So probably by today or tomorrow, we'll get news that Moderna vaccine has been approved. Pfizer already received its emergency use authorization last week, and they have started distribution of the Pfizer vaccine. Phoenix, Maricopa County, and Tucson were the first in Arizona to start receiving the vaccine. As of yesterday, I don't think they had received it yet, but I haven't heard as of whether they have received that yet today. We did decide as a state between all of the 15 counties that the Pfizer vaccine, for reasons we'll explain later, is better off to be used in Maricopa County and Pima County because it's a little bit more difficult to manage and maintain and handle. The Moderna vaccine, from everything that we know so far, seems to be a little bit easier for storage and use in smaller, more rural areas. And so all of the 13 counties that are considered smaller and more rural will be receiving the Moderna vaccine as it's made available next week. So here's our time frame that we've set up for. It's very much an estimate at this point in time. There's all kinds of things that are going to play into this time frame, and I just ask that everyone be a little bit patient with us as we're going to be trying to work on this gigantic project of getting all of our priority groups as well as our whole population vaccinated, at least those who want to be. And so currently, like I mentioned, the FDA is looking to provide an emergency use authorization for Moderna. Pfizer already has that. Vaccine is slated to arrive next week. Now there is a gigantic winter storm hitting the Midwest and the East at this point in time, and so they have warned us that that could put a delay on some of the shipments going out. So we'll be kind of watching and waiting to find out how that looks. First priority in the vaccine distribution is given to healthcare practitioners and technical occupations, as well as healthcare support occupations, emergency medical responders, and then there is a separate Walgreens CVS program, Walgreens and CVS program called the CDC Pharmacy Partner Program. And that was opened up for long-term care facilities, assisted living, and skilled nursing sites who could sign up. That sign up is closed now, but hopefully many of our long-term care sites did sign up for that. So I realize in this group, we targeted this presentation to EMS, fire, and law enforcement. And therefore, I realize that you both law enforcement and corrections and then EMS and fire kind of fall under different priority groups. However, they're very close in terms of the timeframes that we're looking at for vaccination. And so shortly thereafter, once we can get the vaccine and hopefully get it out to our healthcare partners and start working on this first phase 1 of the population, we're going to also, as we move into January, start getting into this phase 1B, which is listed here in the middle of this little chart. That's going to be our assisted living, independent living, HUD housing, DES group homes for those with developmental disabilities, adults with high-risk medical conditions, and shelters and congregate settings, and then law enforcement, corrections, national security. And then our teachers come right after that with the education and childcare. So that's all staff in the schools. And so we do want to try to work through these priority groups as rapidly as possible, because I, really truly hope to get our schools, those that have decided to go to virtual learning, back in session just as soon as possible. And I think things like vaccines and other protective mechanisms that'll help give people a peace of mind to go back to work in person is something we all look forward to. And so we will keep this, focused on information about the vaccine and information that pertains to your group, but I wanted to kind of let you know where you fall into these priorities. As we venture into February through March, we really don't know yet how long it's going to take us to tackle each of these vaccine priority groups. And so we're looking at essential workers falling into the spring months, where once we get through these top priority groups that have the most interaction with our most vulnerable populations, the most exposure themselves, as well as those that fall into really high-risk groups like assisted living and long-term care, we will start working through other essential groups following that. So next slide, please. All right, so Arizona came up with a distribution plan that we are following as closely as possible. And like I mentioned earlier, the Pfizer allocation is slated to go to Maricopa and Pima counties. That is going to be 212,550 doses that are going to go to those areas first. Moderna is going to hopefully follow shortly thereafter next week. And Moderna is expecting to send us 171,200 doses to Arizona. And that'll be split between the counties. Our initial allocation in Yavapai County is 8,100 doses that will be first coming to us in a shipment of 3,000. And those will primarily go to our hospitals and healthcare providers. And then after that, we should be receiving a second shipment that has the remaining 5,100 or more doses as they become available. And that's what we've been allocated for December. And then in January, we'll be allocated more based on supply. And so we will kind of know from week to week how many we're getting. But once we start receiving shipments, we're supposed to receive them about every 2 weeks, 1 to 2 weeks. So there's some agencies in our communities that are going to get a direct allocation from the federal government or the CDC. And those are, the VA is getting their own shipment and allocation starting soon. I think theirs is either on its way this week or next week. And they're getting about 700 doses to be able to vaccinate their staff and probably start working also through many of their patients. Then we've got pharmacies like Walgreens and CVS and other pharmacies is signed up to get direct shipments. And then our tribes will also be getting direct allocations. So for the rest of everybody, we, your county health department, are going to be helping to allocate out doses to people. Healthcare providers have had an onboarding process where they can sign up for distribution and allocation of the vaccine directly. But the rest of everybody, we're going to try to coordinate from our end to make sure that everyone in those priority groups gets vaccinated, and it's going to take a lot of group effort and cooperation, and so we're gearing up and have been for months now to vaccinate everybody that we can, everybody that wants it, just as soon as we can. So on the side there on the right, it just goes through the state plan and how that's going to look, how it's coming out as allocations and working through those priority groups. And it's going to take a little while before we get to the general public. And so I realize that some of you may have spouses and others in your family that want the vaccine. And you as EMS, fire, or law enforcement or corrections might be eligible for the vaccine first. And that's just the way it's been set up through the state and federal government, is to make sure that our priority populations that have the most interaction with our high-risk populations get that vaccine first. And so you may have family members that may have to wait a little while, but hopefully it won't be too long. We're hoping by spring or summer we'll get to those general population vaccinations. Next slide, please. All right, so I wanted to give you some information about the Moderna vaccine. We are learning still, and so keep in mind that until the emergency use authorization is approved, that we don't have a lot of information. Much of our planning has been based off of the Pfizer vaccine. We do realize that the two are very similar, and they're set up very similarly, except for some of the handling, which I'll go through here. But Moderna vaccine has been tested through 30,000 people. It's only allowed to people over the age of 18. It has a 94.1% efficacy rate. And so it's looking like it's going to work pretty well with our populations. It's about the same as Pfizer. Pfizer, I think, was right around that same efficacy rate. So there are some common side effects with getting the vaccine, as with many vaccines, that can include fever, headache, and fatigue. And they're unpleasant but not dangerous and are very temporary, and I'll talk about that in a minute. Unlike the Pfizer vaccine, which requires ultra-low -80-degree temperature holding, the Moderna can be refrigerated for 30 days. And so that is one of the reasons that it's easier allocated to the rural communities, and that we don't have to have a massive ultra-low cold storage station. And we can go ahead and distribute this out to our healthcare providers and partners for easier storage. Any of our partners that have taken on handling of the vaccine and signed up as a vaccine administrator have to have refrigeration that will accommodate to the vaccine, but Moderna is far easier to handle in terms of the temperature requirements. Moderna is shipped in 100-dose boxes as well, whereas Pfizer comes in 975-dose boxes. So in an area like ours, the only agencies looking for that many at this point in time, the 1,000 doses, are the hospitals. And so with that, we will more easily be able to distribute these out to healthcare providers, partners, and other teams that want the vaccine in the smaller 100-dose boxes. So I mentioned that the ultra cold storage makes it really tough to use Pfizer in our rural areas. Pfizer also requires us to keep it on dry ice, and the dry ice has to be replenished every 5 days. And you can only really keep it on dry ice for 10 days. So it's just another reason why that decision was made in our state to utilize Moderna in areas like ours. Neither vaccine at this point in time should be given to people with severe allergies. So it's only been a few people so far, but in a few select cases, people have had a severe allergic reaction. And those were people who had many allergies to other things. And so they're saying if you have people who have a lot of allergies, to maybe hold off until we know more about that aspect of what may be triggering those allergic reactions in the vaccine. Pregnant women can take the vaccine. It's more common that they will have a fever, and yet they are eligible for the vaccine just like everyone else. They don't think that the mRNA vaccines cross over into a fetus or a baby in the womb. So that is something that is an option for women. If they want to get it while they're pregnant, they can. Immunocompromised individuals can be vaccinated, but they may not react as well to the vaccine, and there's no evidence yet to say how long the immunity will last in an immunocompromised individual. So I realize that immunocompromised individuals, those with HIV and other compromising health issues, they are those that are also at high risk for COVID. They can get the vaccine, but they want to, there just isn't a lot of evidence to show how long it will bolster their immune system against COVID-19. So we will be finding out more over time, but those are some of the things that we know about the vaccine. Next slide, please. So Maricopa County drafted up this plan, and what I share it today because I think it gives us some more information on what to expect if you get the vaccine. And so the mRNA vaccines, these are the first mRNA vaccines ever to be used widespread. And so they are getting their emergency use authorization. They have been tested and shown to be effective. And in clinical trials, there are some side effects. And so I want you to be well aware of these side effects, because if you choose to vaccinate your entire team at once, or if you have a large proportion of your team that wants the vaccine, there could be some side effects that pop up, and you might have a shortage in the workforce for a couple of days. And so one thing we're recommending is staggering the vaccine over days or weeks, so that if people do experience side effects thereafter getting the vaccine, you won't be out of your workforce, and you can stagger how many people maybe need to lay low for a couple of days. So with this, the side effects are a little bit more common in younger people, so those 18 to 55, which is probably the majority of your workforce, and far more common in the second dose than in the first dose. What we generally are seeing with the second dose, sometimes the first dose, is that people can get a fever, a headache, fatigue, chills, myalgia, and arthralgia. That's soreness of the muscles and the joints. And so one thing that I've heard that you should not have with the vaccine is the loss of taste and smell. Some of these other symptoms could seem like COVID-19 symptoms, but they said I've heard that if someone does lose their sense of taste and smell, they need to be tested for active COVID-19 infection. Now, with that, though, these symptoms should not last long. So if someone gets the vaccine, they should, if they do experience any of these side effects, they should last possibly 24 hours, but not more than 48 hours. And so what the state is saying here, Maricopa County, and they're looking at what's been recommended, if somebody has these side effects or symptoms of COVID and it lasts longer than 48 hours and especially longer than 72 hours, they should be tested for active COVID infection and excluded from work. So realize that just because somebody gets the vaccine doesn't mean that they have any protection right at that point. When you receive this vaccine comes in 2 doses, and when you receive that first vaccine, it starts to affect your immune system to start building that immunity. The second dose, 28 days later, actually closes in that immunity. And so with that, you're still vulnerable to COVID-19 during that time. And so, and if you were exposed prior to getting the vaccine, or even that same day or shortly thereafter, you don't have that immunity in place yet. So you still need to watch for people in your staff and in your teams that could have COVID-19, so that you're not spreading it around still. You're going to follow those same quarantine and isolation procedures and still get people tested if their symptoms persist for more than 2 days. So keep that in mind. Otherwise, expect that some people that get this are going to have some of these symptoms. And it talks about the fever there as being measured as above 100.4 degrees Fahrenheit or 38 degrees Celsius. And that is what we've been looking for also previously here with COVID-19. So just keep that in mind. You may need to still be dealing in quarantines for a little while until your workforce is vaccinated, but also realize too that it's 94% efficacy rate, and there could be some people that still get COVID-19 oftentimes with vaccines. Once you've been vaccinated, even if you get the virus or contract it, you can oftentimes see lesser symptoms. But we're finding out more about this one as to how that will look. So next slide. All right, I'm going to pass this over to Josh Goldman, and he can explain some more of the details of all this.
Thank you, Leslie. So as we move into phase 1A and phase 1B with EMS, law enforcement, and so on, this group we're talking to today, we are going to be organizing, as you can see on the slides, with our partners to get everyone vaccinated. Paramedics can help administer the vaccine, so we will be utilizing your EMS staff if appropriate.
Josh, real quick, your microphone is really making some extreme noises.
Is this better?
No. I don't know if there's anything David can do to adjust that. Hold on, everybody, for just a minute.
And just a heads up, guys, I'm answering questions in the chat box that you've posted.
Is my microphone still making weird sounds? How about now? Better? Wonderful. Okay. Apologize for the technical difficulties. It worked fine on the last one. So again, Dave, if you don't mind that slide up, please, but I'll go ahead and get started. So we are going to be working on organizing with your agencies as well as our partner agencies, providers, and your EMS to vaccinate these priority groups. So I'll put my email in the chat box, josh.goldman@yavapai.us. Please have a point of contact, one point of contact from your agency, be it a fire department, police department, whatever the case may be. And I will share that with our communication team, and we can reach out at the appropriate time when we get all our ducks in a row and organize a time to vaccinate your staff. And to reiterate kind of what Leslie said in the previous slide, with the possibility of harsh side effects with this vaccine, it is recommended to tier your vaccination. So if you do have a large portion of your workforce that wishes to be vaccinated, tier the vaccine so you're not wiping out your entire staff for an entire week or however long the side effects may continue. So people who have had the virus still can be vaccinated. And again, this is an optional vaccine, so this is not a forced vaccine. Please, when you get that primary point of contact, and reach out to me so I can share your information with our communications team. We need to know a rough estimate of how many people in your department or agency are wanting to receive the vaccine.
Can't see the presentation.
I know, we're working on it. I apologize.
No problem. Thank you.
I was just reading. Sorry. Let you get back and keep talking on the side. So again, apologize for technical difficulties. But that, I know you can't see the slide, so I apologize, but that in essence wraps up what we have. We need communication, rough numbers, and a point of contact from all your departments. Again, I'll put my contact in the chat box, send that to me so we can get in the communication team. And again, we'll be reaching out shortly to organize vaccination clinics for your departments. Thank you. And so volunteer recruitment. This is big. I don't know within your departments, within the community, if you've had requests for volunteers. We've received multiple requests through public health. We are pushing all volunteers to the state volunteer management system. It's ESAR-VIP. It's the emergency system for advanced registration of volunteer health professionals, if you're unfamiliar. So please just take down this information, and any volunteers that come your way, you can direct them here. The benefit of utilizing the state's ESAR-VIP system is it's a statewide pool. So for instance, if we have specific Yavapai County volunteers and we're not able to utilize them at the time, Coconino, Maricopa, surrounding counties can utilize them, because volunteers, as you probably know, want to be utilized, and if they're left in the wind, they can lose interest. So, and then the benefit goes the other way too, that if we have Maricopa or Coconino and other county volunteers not being utilized, we can pull them up to Yavapai as well. Next slide, please.
I think you may actually have to go back to the slide prior. And back one more.
Leslie, do you want me to discuss in any more detail about reaching out and getting kind of in our system so we can get everything organized?
Yeah, some of those things that we were looking for is, we don't have comprehensive information yet from EMS and fire. One of the things that have been allowed on a national level right now is that paramedics can administer the vaccine to their teams as well as to other teams. We're trying to get a better idea throughout the community as to who has paramedics that want to be involved in that process, who's going to be able to vaccinate their own teams, and then maybe even in those jurisdictions, if they're able to also work with others, like if the paramedics could also work with our law enforcement partners or others, that would be helpful for us to know so that we can partner up to get the vaccine to you and get that done. Otherwise, we need to match up our fire and law enforcement departments with either other healthcare providers or our own health department to make sure that we can get everybody vaccinated in a effective and efficient manner. So we will be looking to set up group times and dates, but again, we want to probably recommend to stagger those times and dates so that your whole team isn't having those side effects at the same time. If they may not affect everyone, so keep that in mind, but just consider that an option to possibly do it over a couple of days or a couple of weeks even. And then, yeah, Josh, if you want to go through any more of that information, in terms of you're sharing your email, it sounded like, and I did mention a couple other things on here, and we've mentioned it a couple times that it is optional for everyone, as well as people who have had the virus. We don't know how long the antibody reaction in your body gives you immunity to the virus. So far, it's been very, very limited in terms of people getting the virus a second time that we know of. But we really only had testing starting up in Arizona back in March. And so if someone's had the virus and they want the vaccine, they can get it. And if they have had the virus and it's been several months, they might consider also getting it, because we are seeing some people's antibody resistance or antibody testing starts coming up negative sometimes after 4 to 5 to 6 months after having the virus. So this vaccine, we're not exactly sure how long it will build resistance yet, because it's only been tested for the last several months. But hopefully that will provide a level of resistance or 94% effective rate against COVID-19 for at least several months after receiving it. And then we will be receiving more information down the road as to how long it actually builds that resistance.
And I know Sally's been answering questions in the chat box as we go, and we're going to get into the chat box a little bit more here in a minute. I did see a question regarding volunteers, and Leslie, stop me if you know something different. But essentially, as far as when it goes to healthcare workers, volunteers are paid or unpaid are recognized as healthcare workers. So I think we would carry on the same principle with law enforcement and first responders, that paid or unpaid, you're considered law enforcement and therefore would fall into that priority group.
Yes, that's correct. All right, well, I think we will start working through those questions. And Sally, do you want to start rolling through those again like we did last time?
Yeah, let me get up to the top here. Okay, Charles, what's a communication strategy regarding vaccine rollout for Yavapai County? I'd like to re-message whatever is being implemented. And also, will our PD volunteers who are vital to the day-to-day public safety operations be able to receive this initial vaccine rollout as well, and dispatchers too?
Yes, so I can try to answer that communication plan. We are going to be doing as much communication as possible. However, one thing we're not going to do is be advertising publicly vaccine clinics. We need to keep these limited to priority groups initially, so it's not going to be a big public advertisement, especially once we get into essential worker groups and other groups as to when and where we're going to hold vaccine clinics. So we are going to be educating the public on the vaccine, especially as we find out more just following this emergency use authorization, and talking about, the receiving of the vaccine and those kind of things and which groups are currently being vaccinated. But we will not be advertising publicly those vaccine clinics for a while. So once we get through those priority groups and into more public groups, then we'll start advertising opportunities for people to come and get the vaccine. But earlier, you're just going to have limited information and generalities, not any specific times or dates to come get the vaccine, to try to limit our groups to those priorities.
And Leslie, I can add a little more to that as well. When it comes to kind of the pods vaccinations for this priority group, first responders and law enforcement, it is going to be on a case-by-case basis. That's why we're asking for your contact information and rough numbers you're looking at right now, so we can work with our partners and yourselves and reach out to agencies individually or on a case-by-case basis to organize those vaccination times.
Okay, and the second part of that question was about PD volunteers and dispatchers being part of the first priority group with the law enforcement.
And yes, that they would fall right in there with the rest of the law enforcement team.
Okay, is the county attorney's office considered law enforcement for purposes of the vaccine timeline? I have jury trials scheduled and I'm hopeful about getting the vaccine as quickly as possible.
Yes, I think that we can go ahead and include that in with law enforcement and corrections.
Okay. Will Sedona Fire assist with direct vaccination for first responders?
Please, yeah, thank you for volunteering to help out with that. And when we get down to those nitty-gritty details about who and where and what, yeah, we'll definitely be reaching out and coordinating with you. Thank you.
Does 8,100 doses mean 8,100 people get vaxxed or 40-50? So that means we are going to push out as many of those 8,100 doses for the first dose of the vaccine for as many people as we can, considering that we'll have hopefully weekly allocations. Those second doses will come in a later shipment. So we're going to try to get 8,100 people dosed as quickly as possible for that first one. Daniel Grinnell, how can EMS fire providers assist with vaccinations? Josh?
So again, it's come down that EMS personnel are able to give vaccines. So we will be reaching out and coordinating again with our local partners, healthcare providers, and then again, agencies such as Sedona Fire to work with their EMS and organize clinics for first responders. And then there's also a possibility of other sub-priority groups also.
Thank you, Josh. And I did answer this in the chat, but I'll go over it for everybody else as well. What constitutes severe allergies? So a severe allergic reaction like anaphylaxis to another vaccine or an injectable medication is a precaution to this vaccine. You need to make sure that you have all your emergency supplies on hand in the event that the patient should have a severe allergic reaction. It is a contraindication to the vaccine if any patient has an anaphylactic history to any component of the vaccine. They should absolutely not receive the vaccine. Are they looking into what is in the vaccine and what severe allergies people had?
So far from what I've heard is that if anyone has had a severe allergic reaction, whether that be to foods or any other thing, probably something that sent you to the hospital or caused an anaphylactic reaction that would be severe, that they should hold off until that can be identified, because it's only been a few select folks that have had that reaction. They're still trying to identify if there is a component in the vaccine that is triggering that in these people or what. So I would just recommend that if you've had a severe allergic reaction to anything in the past, to be careful and probably wait a little while to get the vaccine till we know more.
If a pregnant woman gets the vaccine, do they have any idea what the potential effects would be on the unborn child? Right now, there is no safety data or information on what could happen if we vaccinate a pregnant woman. However, it is not a live vaccine. So should a mother choose, or a pregnant woman choose to be vaccinated, she may, within those priority groups.
Yeah, and to add on to that, they have mentioned yesterday in a meeting I was in that they don't think that it crosses over at all into a fetus or an unborn baby in the womb. And so that obviously probably has been tested in very limited people, because there's only been 30,000 people tested, which is a lot, but I'm sure a small minority of those were pregnant. So it doesn't appear that it has any effect on an unborn baby, but we are still learning a lot about this vaccine.
Okay, would the reference to people with severe allergies be central to allergies other than seasonal? Yes, it is. If they just have seasonal allergies or allergies to animals or whatever, go ahead and proceed with vaccine. Marshall Relly is asking, when it becomes available to Ellie, would a representative be available to come to our office to administer the vaccine to our officers and personnel? Maybe.
We're trying to figure out these kind of things, and that's why knowing who else, and especially if there's a jurisdiction that has paramedics that are going to be willing to help, we may be setting up people with other healthcare providers, or setting up our own on-site being our YCCHS offices, clinics. We may, in some occasions, come out and do the vaccine, but we may be asking you to come to our office as well, just because we have the supplies there and everything more readily available. But we'll be working with each of you and finding out what you need, what we can accommodate, as well as if there's other partner agencies that can help to accommodate those vaccines and the administration of the vaccine.
Is the second dose the same as the first dose as far as ingredients, or is it something different? They are identical. There is no difference. If a person had tested positive for COVID-19, would they be eligible for the vaccine? Yes, following recovery from acute illness. Leslie mentioned 28 days later for the second shot. I thought the prior slide said 3 weeks. Pfizer is a 21-day interval between dose 1 and 2. Moderna is a 28-day interval between dose 1 and 2.
And I apologize for that. I did notice that little image shows 3 weeks in between. And with Moderna, most of our information so far has been based off of Pfizer because it's already been granted its emergency use authorization. We have far more information about Pfizer. However, we do know so far that Moderna is 28 days apart and can be a longer duration of time, but cannot be shorter than that period of time between the two shots.
Okay, Randy Chapman, some of our department volunteers want to be vaccinated. Will they be eligible as law enforcement? Leslie shakes her head yes.
Yes, we've addressed that question, and all law enforcement, first responders, paid or unpaid, will be treated the same. So yes.
All right. Do you have a standardized form for those who decline the vaccine? No, at this point we do not. The vaccine is optional, so we fully expect to only have people reach out to us who want the vaccine. Can you put your email in the chat? I did put Josh's email in the chat. Josh, will you throw mine in there? Is there any indication that someone that has tested positive for COVID, that they are immune, or what is the recommendation? So if they have tested positive for COVID-19 in the past, we don't know how long those antibodies or that protection lasts for, so we do recommend vaccinating, yes. How hard a date is it 28 days after the first dose? Is there any tolerance? Yes, so we have a 4-day grace period before the 28 days. So if we can't hit right at 20 days, you got 4 days before. As far as going longer than 28 days, there's not much strong guidance at this point, but what the state is saying that we don't need to repeat the series, we don't need to redo that first dose, just try to get it as close to that 28 days as possible. Charles, who from our agencies are eligible so we can accurately assess need per request for numbers? Josh, I think you may have already gone over that.
Yeah, I can answer that in a little more detail outside of just volunteers. So essentially there is a lot of gray area in these priority groups, from what is considered an essential worker to what, say, a hospital considers healthcare personnel. But ultimately, yes, everyone in your agency at this point, for my sanity, really, just for nice, clean organization and just to benefit everyone within your agency will be considered within that priority group.
Okay, are department volunteers eligible for the vaccine during law enforcement? We answered that. Did Josh say that this is not a forced vaccine? Correct, it is voluntary. Absolutely not required, just highly recommended.
One of the questions that's in here that's come up prior to this presentation as well is the declining of the vaccine. And some departments, Dennis Light had sent me, or we talked about a form. We've had other vaccinations and other things that we've, even as a health department and other groups, like the Hep B declination form, if people decline a vaccine, you may consider utilizing a similar resource, and we could get a template and possibly send it out also. But that way, you know, if somebody has declined it or if they've received it. And at this point, Governor Ducey has mentioned a number of times that it's optional for everyone. They're not going to make it mandatory from a statewide level, but that could be differing from agency to agency. And I would recommend consulting your legal departments or anyone that you can consult with before you make it mandatory. But you may also want to utilize a form that people acknowledge if they're declining it or not. Now, one other question that's come up is if someone declines it initially, but they decide 6 months later that they want it, yes, we can generally accommodate, and I'm assuming we'll have far more supply of the vaccine in the future that we will be able to go back and vaccinate those, probably by an appointment at the health department, vaccinate those who did not get it the first round.
Okay, Maddie, what information, if any, is there about how the vaccine could affect fertility? I don't know yet. I haven't seen the studies on that. Are all members of our EMS departments, regardless of paid or volunteer status, eligible? Yes. Should people with COVID, with active COVID, be vaccinated? No. Defer vaccination until they've recovered from the active infection and are no longer needing to be isolated. Randy, I really hope we got to your question. Let's see, how quickly does Josh need the numbers of people interested? As quickly as possible, please. What about our civilian volunteers at PD? Yes, they fall into the same category as you, James. Could you talk a little bit more about people with severe allergies? I'm allergic to penicillin, cats, horses, pollen, juniper trees, etc. I would gather that it would be a person that, okay, so as far as penicillin, if you have an anaphylactic reaction, it's probably not a good idea for you to get the vaccine. So the contraindication is if you are severely allergic to any component of the vaccine. The precaution is with severe allergies to other medications or injectables. As far as your cats, horses, pollen, juniper trees, that's not any precaution or contraindication. It's proceed with vaccine according to the algorithm that the state sent us. Corey, we have a large volunteer group for the PD. Where would they fall under the timeline? We use them on crime scenes. Josh, that's for you, but I believe they fall into the law enforcement category.
Yeah, same thing. Anyone within your agency, paid or unpaid, whether it's dispatch, frontline law enforcement, volunteers, all fall into that same priority group.
Okay. Bill, thanks for the information. Can you email that to myself and Josh? Will private local medical providers, doctors' offices, urgent cares also be receiving the vaccine batches? And if so, will the vaccines be distributed only by priority groups? So at this point, if providers have onboarded with us and are showing active, then yes, they will receive allocation of the vaccine to vaccinate according to priority groups, not the general population at this point. Will services be brought to Yarnell or other outlying areas at any time for distribution to assist with the infirm, disabled, low-income, elderly in accessing the vaccination? At some point, yes, I am hoping to run it like I do our rural flu clinics, where I bring vaccine out to our rural areas and vaccinate the public. But that will be based on priority group and staff availability and, again, the stability of the vaccine if I can take it out. Should someone that tested positive for COVID test negative before getting the vaccine? No, there is no recommended testing, whether it's an NP swab or serology prior to vaccine.
One thing to add to that, though, is that they do ask that you have fully recovered from the active COVID infection. So someone needs to fulfill their isolation period and have 24 hours absolutely symptom-free before going and pursuing getting the vaccine.
Thank you. Tom, running rough numbers from one of the early slides, 171,200 Moderna doses to the 13 rural counties. Yavapai County is roughly 10.2 of the approximate population to those 13 counties. I'm not sure what your question is, Tom. Charles, do we have a declination form that we can share? Yeah, I think as Leslie said, we can probably share the template for our Hep B declination or acceptance form. And Josh is putting in our email addresses, and a copy of our presentation should be posted on the website. What are the components of the vaccine? Sorry, real quick. It is in the EUA fact sheet from Pfizer and probably on Moderna's website or the FDA website for Moderna. I don't have that one in front of me.
One of the things to clarify with the, if the question previously was based on our proportion of the population and the proportion of the vaccine that we're receiving, something's played into that in terms of the state's knowledge based on census and other things of our actual priority group populations. So it's not necessarily populations in general that created that first allocation number. It is how many healthcare providers, how many first responders, how many others that fall into those groups we have here in Yavapai County. So we've gotten a proportion of the vaccine, and to clarify, that 8,100 doses is only our December allocation. We'll be getting more allocation, and our allocations roll forward. So even if we're not ordering them all in quick succession, because we want to make sure our provider partners can use the vaccine as soon as it comes in, we won't be losing any of those allocations. They all roll forward as we're able to use them.
All right, and that's it for the chat box.
All right, this is your last chance to ask questions here, but of course, you all have my contact information, I know, and now hopefully you've got Josh and Sally's too. We do have the hotline number that's always, not always open, but 8 to 5, Monday through Thursday. We have our hotline that people answer questions as well. That's 442-5103. And so, you know, if you've got any last minute questions, throw them in the chat box now. Otherwise, we are going to post this presentation to our website and hopefully to Facebook too. And so if people missed out right now, they can catch that information later. We did just want to make sure that we had a live version that you could ask these questions and get as much information as possible out here in a quick, short turnaround. And so I appreciate very much that all of you have attended and listened in. Hopefully it did give you more information than you had prior. And we look forward to working with each of you and making sure that we can vaccinate your teams as needed and get through you as top priorities for this vaccine. And then, you know, if you have questions anytime in there, please ask. Let us know how many people you have that want the vaccine, and we will either set you up with a healthcare provider who is onboarded to provide the vaccine, like YRMC or others. There's many others, 27 others that have onboarded as vaccine providers, or we will work to vaccinate your team ourselves as well. So thank you very much. Has there been any other questions pop up?
No more questions in the chat box.
Okay. Well, thank you everybody very much for your time. And as I mentioned, we look forward to working with you in the coming weeks as we get vaccine. We will be in touch and make sure you get in touch with us too. We're going to try to post a link in our website in the next few days that you can also send us your requests for vaccine. So I would need your contact information and an approximate number of folks that need to be vaccinated. Otherwise, in the interim, go ahead and email Josh, and we will start compiling those requests and then setting up times and dates with you, hopefully in the very near future. So watch for the news today, see if Moderna gets approved, and that will be our first step in the right direction to getting our vaccine. So thank you all very much. Appreciate your time, and I hope you have a great day.